Parkinson's is a disease that is a result of the loss of dopamine-producing cells in an area of the brain called the substantia nigra. Therefore, replacing these cells via the use of stem cells is a suitable treatment. A person is diagnosed with Parkinson's when they have already lost approximately 50% of the dopamine-producing neurons in the substantia nigra. The current drug therapy is levodopa. Levodopa has been used as a medication against Parkinson's since 1970 when it was approved. It converts to dopamine in the nervous systems, and it compensates for the decrease in dopaminergic neurons. This, however, is just a temporary solution to a permanent problem. There are many adverse effects caused by taking levodopa, such as nausea, hallucinations, psychosis, and in more severe cases, muscle rigidity and hypothermia. This is because levodopa is taken orally, so there is a constant rise and fall in the brain's dopamine levels. The stem cells that were used were allogeneic stem cells, which are stem cells that are donated by another person, and these were seen to work better than autologous stem cells, which are taken from the patient's own body. This is because allogeneic stem cells typically come from young and healthy donors, which means they're typically of a higher quality and have better regenerative potential. In Parkinson's patients, the autologous cells might already be affected by disease or aging, making them less effective. The specific allogeneic stem cells that worked best were neural progenitor cells and fetal stem cells. The neural progenitor cells are early-stage stem cells that can specifically develop into neurons, including the dopamine-producing neurons lost in Parkinson's disease. Because of this, these stem cells integrate better and are more likely to replace the lost neurons, meaning they can directly help to restore the dopamine levels in the brain. They also take very little time to differentiate into neurons, ranging from days to a few weeks. This is much quicker than iPS cells, which take 4 to 6 weeks to differentiate. Fetal stem cells are derived from early stages of human development and are highly versatile. They are particularly good at transforming into different types of neurons, including dopamine-producing ones. Studies show that these cells survived in the brain but also formed connections with surrounding brain tissue. However, there are many ethical issues involved with fetal stem cells because they are derived from aborted fetuses. The procedure takes 4 to 12 fetuses per patient, and there is no way this can be done for thousands and thousands of patients. It isn't ethical or practical. Another downside is the cost of the whole procedure. The estimated costs for one patient to undergo stem cell procedure for Parkinson's is around $30,000 to $50,000. There are also side effects involved with cell therapy: nausea, fatigue, and unfortunately, dyskinesia. Dyskinesia is a condition where patients experience involuntary movements which may be related to the transplant procedure. In rare cases, patients might experience seizures which could be linked to the presence of transplanted cells in the brain. Overall, cell therapy could be a helpful tool in managing Parkinson's, but more research is needed to refine the treatments and ensure the patient safety